For me, oncology isn't just a specialty. It's really a personal mission. It's about turning pain into purpose and hope into action. Chernobyl never broke me. It became my why. Through partnerships, I truly believe we can reshape how healthcare information is delivered, accessed, and even understood.
Welcome back to OncoDaily. My name is Emma Ter-Azaryan, and I'm the content coordinator of OncoDaily TV. Today, it's my pleasure to introduce you our new guest, Dr. Jan Leyfman. Hi, Dr. Jan. It's very nice to meet you.
Thank you. Equally, it's a pleasure to meet you guys as well.
So before we start, I would like to briefly introduce Dr. Jan. Dr. Jan is the co-founder and executive director of MedNewsWeek. Besides the medical journalism, Dr. Jan Leyfman was honored as a 2023 40 Under 40 Emerging Leader in Cancer at the ASCO annual meeting. During the COVID-19 pandemic, he led the immunology division of the global COVID-19 task force that produced early models of SARS-CoV-2 and COVID flu. And it's my pleasure to meet you today, Dr. Jan. I think we can start our interview.
Awesome.
Dr. Leyfman, what sparked your interest in oncology and immunology, and what made you decide to focus on this field?
So I'm one of the few survivors of the after effects of Chernobyl from the largest hospital in the former Soviet Union. Now, growing up in this area, radiation was everywhere. Although I was asymptomatic at first, I really began to experience widespread symptoms by the time I turned 2. And that included things like diffuse lymphadenopathy, weeping wounds, and cysts all over my body. I would go from clinic to clinic, hospital to hospital, but no one really was able to diagnose or much less treat me. In the largest and most advanced hospital in Belarus, I was the interesting patient, where doctors would come from all over the country, but no one could really diagnose nor offer me any relief. Eventually, I was placed on hospice, and with my condition then deteriorating by the day, I still remember those feelings, the feeling of helplessness, as if it was yesterday. But my parents, it was really my parents that were there for me, and they inspired me to never give up. I'm really alive today because of them. And the fact that they were able to connect me with life-saving care abroad is really why I'm here, sitting and speaking with you today. Now, I never forgot the medical staff's warm and proficient care that not only saved me, but really led me to find purpose. And that purpose led to an appreciation for medicine that really has continued to resonate throughout my clinical training. Now, I was the child who was really never supposed to make it, but did. But I never forgot what it's like to be a patient. And so I'm grateful to be alive, and I live every day like it's my last. And that's really why I started to do research at the age of 15 as a means to give back, until one day I can really become a full-fledged physician and combine both my clinical knowledge and my research background, really to have that positive impact on the lives of my patients as the physicians who had saved me. But the moment that really changed everything was when my mom was diagnosed with cancer, because suddenly it was not just science anymore. It really became personal. And so watching her go through chemotherapy and radiation therapy, and then seeing the pain, the fatigue, and the helplessness that she felt. But this time was different because then I was able to do something. I had tools. And so I threw myself into cancer research with a new sense of urgency. Research became now an outlet. And while I couldn't treat her, I could try to help others like her. And that's when I joined labs that combined both oncology, stem cell biology, and gene therapy, fields that I believe could offer less toxic and more targeted and effective therapeutics. And from that moment on, I knew that this is where I meant to be. And for me, oncology isn't just a specialty. It's really a personal mission. It's about turning pain into purpose and hope into action.
Thank you so much, Dr. Yan. And I would like to continue talking about your personal journey. So as a Chernobyl survivor, how has that experience influenced your approach to cancer research and patients today?
So being a Chernobyl survivor really shaped everything about how I approach clinical care. It's something that I carry with me every single day, not as a burden, but really as a reminder. I'm reminded what it's like to be a patient. I remembered the fear, the confusion, the exhaustion. And so every time I walk into a patient's room, I try to bring that perspective with me because I want every single patient to truly feel seen and heard, just like the doctors who took care of me and my mom. Honestly, this experience really gave me a sense of purpose. I think a lot about the kids who didn't make it. Over 1,000 children died from the aftermath of Chernobyl. And the fact that I'm still here today when so many aren't really fuels me. Their hopes, their dreams were never realized. And so I made it a mission to honor them with my results. So that's why I'm so driven both in patient care and in research. I don't just want to treat cancer. I want to help move the field forward, whether it's through clinical trials, new therapies, or better ways to connect with patients. I want to keep asking, how can we do better as a whole? So for me, progress isn't about big discoveries, although they are important. It's about showing up every day, giving everything I've got. I wake up every morning asking myself, how can I be a better version of myself? Whether it's to learn something new, connecting with the patient on a deeper level, or pushing a research idea forward. That's all that matters. In a way, Chernobyl never broke me. It became my why. And this ignited a fire that hasn't gone out, and I don't think it ever will.
It was really inspiring to hear your story. And moving forward, as we know, you've contributed to the development of new anti-cancer therapies that are now entering clinical trials. Could you share a little about one of these breakthroughs and what it means for the future of cancer treatment?
So, during my early research career, I was fortunate to work on two innovative projects, each with the potential to help patients and hopefully enhance the landscape of the field. And it has been a pleasure to watch both of these studies really progress toward and within clinical trials. Now, as an undergraduate at Stony Brook, I joined the Bachkina lab where I focused on cancer stem cells in metastatic colon cancer. We initially began by analyzing patient-derived cells really to map out the gene profiles responsible for both stemness and metastasis. Once we had a better idea and understanding of these pathways, we tested a novel next-generation taxoid just to see how it affects these genes. Now, not only did we see a drop in expression at the molecular level, but we tested this in animal models. There was also minimal recurrence. Now, following graduation, the therapy progressed into early phase clinical trials. And really, this was my first glimpse of how basic science can directly fuel clinical innovation. Then, after graduating from college, I joined the satellite lab at Memorial Sloan Kettering Cancer Center, where I focused on improving CAR T-cell therapy, which is a cutting-edge cancer treatment that really trains a patient's own immune cells to target and destroy cancer. Now, the challenge at the time was when using traditional methods like viral vectors, it caused inconsistent CAR expression, which could impact treatment outcomes. And so, for those that don't know, CAR T-cell therapy really is a type of cancer therapy where doctors take a patient's own immune cells, T cells mainly at the moment, train them in the lab to recognize and attack cancer, and then we infuse them back into the body to fight disease. Essentially, it's like turning your immune cells into heat-seeking missiles that target cancer cells, largely sparing the good, healthy cells. So, taking that into account, we developed a novel gene-targeting platform using TALENs, transcription of activator-like effector nucleases, combining with oligonucleotides in induced pluripotent stem cells. Now, initially, we applied the strategy to fixing the sickle cell mutation in iPS cells. And then once we confirmed, we then adapted this technology to develop a gene-targeting platform for chimeric antigen receptors. Now, utilizing this platform, and after showing that we were effective, we then targeted the insertion of CARs into specific regions of the genome known as safe harbor sites. And when we did that, we were able to see improvement in both the safety and the consistency of CAR expression that really laid the foundation and the groundwork to then applying CRISPR-Cas technology that was later done in future studies. Building upon this work, members of the lab then published a pivotal publication that really showed that when they were able to insert the CAR into this particular site in the genome known as the track locus using CRISPR-Cas, this resulted in more uniform CAR expression and a significantly improved T-cell potency in models of ALL. Now, this strategy would then enter clinical trials in 2020. So, looking back, both of these studies really taught me the incredible power of translational research, from molecular discovery to therapeutic application. And really, the thing that excites me the most is how these strategies can make treatments not only more effective, but also more precise and safer. These breakthroughs really offer patients hope for especially those with relapsed disease, and it's deeply fulfilling to be able to contribute to them.
It was really exciting to hear about CAR T cell therapy and CRISPR as well. So let's move on to the COVID-19. As we know, during the pandemic, you joined the global COVID-19 task force and worked on developing treatments for COVID-19. How did your background in immunology help you contribute to understanding the virus, and what lessons from COVID-19 can be applied to cancer treatment?
So, when the COVID-19 pandemic hit the United States, I felt this overwhelming sense of helplessness. Having to watch friends, family, and colleagues fall ill one by one, like dominoes, but really brought back memories that I had of Chernobyl, of the long hospital stays filled with cries of children in pain, and of the healthcare system that was being overwhelmed and underprepared. Having survived the aftermath of Chernobyl myself, it really felt like deja vu. But this time, I really felt that we had more tools to help. So I had made a promise to myself years ago that if I had the chance, if I could, I would do everything in my power to help prevent another tragedy like that from ever unfolding again. So it just so happened that when I was invited to join the Global COVID Task Force, I didn't hesitate. Initially, I was brought on as special advisor for immunology, oncology, and cellular therapeutics, and then was later asked to lead the immunology division. If I could pull together an international team and deliver real insights quickly. It was a tall order, but I leaned into my training, my background, and within weeks, our team proposed one of the first cohesive mechanisms of action for SARS-CoV-2, findings that are still relevant today. Now, our team was amongst the first in the world to really explain the efficacy of a promising therapy against severe COVID-19. And we were proven correct when one of the companies within the space really demonstrated promising clinical trial data and then received US FDA Fast Track designation on December 1st, 2020, about a week before the vaccines were approved. And this really was an incredibly validating moment for our whole team. But really what made this most meaningful is really the bridge that this work created between infectious disease and cancer care. Leveraging my immunology background, I really began to explore the links between severe COVID-19 and malignancies like multiple myeloma and diffuse large B-cell lymphoma. And we found striking overlaps in immune dysfunction, particularly in how cancer and the virus exploit the body's defenses. This then opened up exciting possibilities for using cellular therapies like mesenchymal stem cells, like exosomal vesicles, not only for COVID-19, but also for immunocompromised cancer patients. So I've since had the honor to share this work at national and international meetings, including ASCO, SOHO, ASCCT, and Memorial Sloan Cancer Center Cellular Toxicity Conference. And this work was also published in BMC Hematology Oncology. I'm especially grateful to mentors like Dr. Chandra Park and Pushpa Sharma, whose guidance really helped our earlier ideas take off and manifest into actionable science. Now, the biggest takeaway from all of this is that cross-disciplinary collaboration can really transform a crisis into innovation. And the lessons that we learn from one public health emergency can inform and elevate care in another. For me, COVID-19 wasn't just a challenge. It was really a call to action. And I really hope that the work that we've been able to do continues to make a difference, especially for the most vulnerable patients.
Thank you. Let's move on. And looking ahead, where do you see oncology in the next decade? What do you think will be the most exciting developments in cancer treatment? And how will new technologies like gene editing and personalized therapies play a role?
So the future of oncology is rapidly evolving before our eyes. I truly believe that the next decade will bring a major shift toward highly personalized cancer care. Gene sequencing and molecular profiling are already becoming more mainstream, and I see that becoming the standard of care across all institutions, not just the major academic centers. This molecular level of understanding of each patient's disease helps to guide treatment choices, helping us to tailor therapies in a way that's far more precise and more effective than just a one-size-fits-all approach. And if we don't have a therapy that targets a particular mutation, that's where the future gets really exciting. I think have a lot more translational work to develop custom or semi-custom therapies based on the patient's unique tumor profile. Of course, that's a bold vision, and only time will tell how quickly this can be brought to scale. But where tools like CRISPR-Cas and gene editing hold great potential. That said, innovation is only as good as its accessibility. A big concern right now is cost. CAR T-cell therapy, for example, is incredibly effective for some patients, but also incredibly expensive. Even with insurance or Medicaid in the United States, it's not always fully covered. So moving forward, we'll need to really think creatively about how to streamline production, reduce costs, and make these breakthroughs available, not just in the wealthy of nations, but across the globe. Now, another area that I see playing a transformative role is artificial intelligence. AI has the potential to really help clinicians quickly analyze complex molecular data, predict responses to treatment, and even stimulate various human therapy pathways. As I often say, the best oncologists aren't just thinking about the next move. They're thinking about 2 or 3 moves ahead, like a game of chess. So if plan A doesn't work, what's plan B? What's plan C? What's plan D? And AI can really help to make these strategic decisions both faster and smarter, ultimately improving outcomes for our patients. It's really an exciting time, and I think that we've just scratched the surface.
Talking about research, I would like to ask you, many cancer therapies show promise in early trials, but struggle to succeed in later stages. What are the biggest challenges in bringing the treatment from research to clinical use?
So one of the biggest challenges is what looks promising in the dish, what looks promising in the lab, or even in animal models, doesn't always have the same effects in humans. Biology is incredibly complex, not just and since not every single disease is fully understood, this adds another layer of unpredictability when we move a therapy from the bench to the bedside. We've always had to accept that side effects will happen. The key is really anticipating and managing them early on so we don't carry inefficient therapies forward too much. Another major hurdle is the regulatory process. It's incredibly rigorous, especially in the United States, as it should be, for patient safety. But navigating it takes time, coordination, and really a deep understanding of evolving requirements. And even once a trial is improved, recruiting enough of the right patients for the clinical trials can be difficult as well, especially for those with rare disease or those in underrepresented populations. But the good news is, with global collaboration, better disease characterization, and cutting-edge technologies, we're getting better and better at it, at identifying potential issues sooner. So we're not only reacting faster, we're starting to get proactive. And really, it's a dynamic process that's becoming more refined with each breakthrough.
Another question I have about research is, what do you think is the most important factor in speeding up the process of turning cancer research into effective treatment, and how can collaboration help?
So I think one of the most important factor is breaking down the silos. So much amazing research is happening in different corners of the world, but often it's not being shared in real time or translated into something that's actionable fast enough. Collaboration, especially across institutions, countries, and even industries, is really changing that. So when researchers, when clinicians and data scientists work together from the start, I feel we can shorten the feedback loop between discovery and clinical application. It's not just about publishing results. It's about building a system where findings are immediately connected to trial design, patient stratification, and even policy discussions. The faster we can close that loop, the faster we can bring these novel treatments to patients at the bedside. On a practical level, this really means more open access data sharing, global clinical trials, and platforms that can encourage interdisciplinary work. I've seen firsthand how powerful that can be. When people come together around a shared mission, progress happens not only faster, but smarter. And collaboration isn't just helpful anymore, it's really essential.
My next question will be, as we know, your experience in immuno-oncology and cell therapies, what do you see as the next frontier in cancer treatment? And how can we prepare for the challenges that may arise as these treatments become more widespread?
In the immuno-oncology space, I think the next big frontier is really off-the-shelf allogeneic therapies. The ability to deliver effective treatments without long wait times of personalized manufacturing could be really transformative, especially for patients who have rapidly progressive disease where time is everything. Now, at the moment, we're just moving toward a future where gene sequencing and molecular profiling will hopefully become standard practice. That means we'll be identifying specific cancer signatures early on and using the data to guide immunological approaches up front rather than defaulting to chemotherapy. It's really a shift from a reactive to proactive care and really opens the door to more durable, targeted, and lasting remissions. Now, what's also really exciting is how these therapies can be expanded beyond cancer. We're now seeing early successes in applying cell therapies to autoimmune diseases, chronic inflammatory conditions, and even infectious diseases. That cross-disciplinary expansion means that we're not just changing oncology, we're reshaping medicine as a whole. Of course, none of this progress matters if patients can get access to these treatments. Cost, infrastructure, and logistical barriers are still and remain still major challenges. But with advances in automation, decentralized manufacturing, AI-driven optimization, there's real potential to lower costs and bring these therapies to more patients globally, especially those in resource-limited settings. Now, looking ahead, I think that the key will be to build strong interdisciplinary and international partnerships to accelerate development, share data, and create scalable solutions. The science is there. The next step is to make sure we can deliver it equitably and efficiently. And that's the kind of future I'm most and really excited to build.
So, what advice would you give to young researchers and oncologists who aspire to make meaningful impact in oncology and immunotherapy?
So that's a really great question. And there's really no one size fits all answer. Their journey really depends on where you're coming from. As an immigrant, I've seen both sides of the journey. If you're coming from a developing country, resources can be limited, but that can spark a fire, can fuel an even stronger drive to bring opportunities at institutions with the tools and mentorship to help one unleash their potential and ultimately thrive. It's not always easy, but there are logistical and financial hurdles. But if one believes in their purpose, is motivated, and they don't let anything stop them, then they can achieve anything. But for those in resource-rich settings, the challenge is often different. Figuring out what truly excites you. Basic science is not easy. Experiments fail, projects hit dead ends, and progress can be slow. So it's really critical to find that one question, that one cause that keeps you curious and waking up energized so that even when things get tough, you're still motivated to see it through. Failure is a part of the process. It's not a sign that you're doing something wrong. It's a sign you're pushing the boundaries. The key is not to let setbacks extinguish your passion. That inner fire is what will carry you through the toughest patches and ultimately help to make an impact. My biggest advice is really to never stop growing. Read widely, stay curious, go to conferences, engage in conversations outside your comfort zone, and don't be afraid to think differently. Some of the most transformative discoveries in our field came from people who dared to challenge the norm, challenge the convention. If you stay hungry, if you stay humble, if you stay bold, your impact is just a matter of time.
Thank you so much. So, lastly, I would like to talk about MedNewsWeek. What's your vision for MedNewsWeek in the future? And how do you see the partnership between research, media, public education shaping the future of cancer awareness and care?
So in early 2022, Dr. Chandler Park and I launched MedNewsWeek as a response to the overwhelming medical misinformation we were witnessing during the pandemic. We wanted to build something different, a free global platform that could help bring together the brightest minds in medicine to share accurate, timely, and accessible information with the world in real time. And thankfully, it took off. In just 6 months, we hit 41 million Twitter impressions and presently reach an audience in over 100 countries, including more than 40 from lower socioeconomic regions. Our flagship program, Keynote Conference, features world-renowned leaders in medicine, while our Medical Spotlight series shines a light on rising stars whose voice and work deserve greater recognition. We're especially proud of our Voices in Lymphoma Women Shaping Care series through our collaboration with OncLive and Women in Lymphoma, which elevates female trailblazers in the field, a step toward correcting long-standing gender disparities in medicine. But MedNewsWeek isn't just about content, it's about community. We've mentored, and something Dr. Parker and I are very passionate about, over 20 underrepresented students across the globe, helping them to publish, present, and grow into hopefully future leaders in the medical field. And that's a key part of our mission, to build bridges not just between science and media, but across generations and across continents. Looking ahead, I see MedNewsWeek continuing to expand, not just in reach, but in impact. We aim to continue to become a trusted hub where patients, medical professionals, and the public can come together, learn from top experts, and share accurate, digestible medical content. Through partnerships, I truly believe we can reshape how healthcare information is delivered, accessed, and even understood. It's about empowering people, whether they're physicians, their patients, or even aspiring researchers, with the tools that they need to make informed decisions and ultimately help to improve outcomes globally.
Thank you so much. I would like to say that it was a great honor for me to interview you, Dr. Yan. And I hope we can do a lot of other interviews regarding the MedNewsWeek and other research and publications and the work that you're doing. Further, we can discuss it all as well. Thank you so much for accepting our invitation and being here with us today. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.